Hello, my name is Nicola Blank from Self Advocates Becoming Empowered. I am here to do a video blog for healthcare professionals. I will be sharing tips for working with people with autism and other developmental disabilities. These suggestions come from us. We often face challenges getting quality healthcare. When we go to a doctor, there are certain things we want and expect from our doctor. Like all patients, we want to be treated with respect and felt listened to. But sometimes a person may have a different communication style. Start by assuming a person can understand you. Then make adjustments based on our responses. Ask the person how they would like to communicate. If they do not use speech, they may use an iPad or other devices. They may indicate yes or no to questions by using eye gaze, or head or hand movements, sign language, gestures, or facial expressions. Being in a doctor's office can be stressful and anxiety-provoking. Therefore, some people may need to be encouraged to speak up and make decisions for themselves. Don't assume a person who has limited or no speech cannot understand what is being said. People usually understand more than they can express. Look for something that indicates a person understands. Respond to any attempt the person makes to communicate. Now I will share my personal story and experiences with the healthcare system. This past summer, I caught cyrospora and I went to my doctor and they told me to go home and do a stool test and go take herbal remedies. And as a result of that, I ended up in the emergency room with an IV because my staff person noticed me being dehydrated. This is one example of the challenges we face in accessing healthcare. So back to our tips. Please presume competence. We want healthcare professionals to see us as competent. We recognize your expertise, but we need healthcare professionals who are willing to work with us as we describe our concerns and find the best treatments. Some doctors find it helpful to schedule longer appointments so there is ample time to ask and answer questions. Have patience. It may take a little longer for people to respond and give you an answer. It helps to have awareness or general education about our disabilities. We may need support to review and recognize side effects of medications. Please don't let appearances fool you. Always treat adults as adults. Use a typical tone of voice, just as if speaking with other patients. Speak directly to us, not our parents or support people or companion. If you do think it would be helpful to talk to others, please ask for our permission before talking to our support workers or family members. One big issue is who decides. Let a person make their own decisions. Don't take over and make decisions for them. It may be difficult for some people to make quick decisions. Be patient and allow the person to take their time. Here are my final tips for healthcare professionals. Use direct questions rather than abstract phrases. For example, ask, "Have you got a pain?" rather than, "How do you feel?" It also helps to only say one idea in a sentence. Please be aware of how fast you are talking. Give the person plenty of time to respond to what you've said. It may take time for some people to process the words they hear. In addition to explaining, it can be helpful to demonstrate any examination or procedures before you do it. By demonstrating what you are going to do first, you may reduce anxiety. For many reasons, people with disabilities experience barriers in accessing healthcare. People with disability experience a wider range of health problems than the general population. They may also take social support to seek out medical treatment. Do not delay care. Ensure proper diagnostic tests are carried out whenever unexplained symptoms or physical changes are noted. Avoid diagnostic overshadowing. Do not assume any changes in behavior or deterioration are caused by our disabilities, and do not make assumptions or judgments about the person. Try to see the person, not the disability. We often hear many examples of the medical model in the media that states people with disabilities are broken and need to be fixed, or that autism is a disease that needs to be cured. These basic assumptions about disability devalue us. The civil rights movement, on the other hand, views disability as a natural part of the human experience. We suggest you go adopt the World Health Organization's definition of disability that states that a person is more or less disabled based on their interactions within the environment. Thank you for listening to our video. See you in our next one. Goodbye.